In this chapter, we're going to talk about the necessity of communicating the need for veterinary care to pet owners. We've talked a little bit about tracking important metrics, about marketing your practice. After this session, we'll also talk about pricing, bringing more cats into your practice, and making it more convenient for clients to visit your practice. One of the things that was very striking as a finding from this study was the number of clients who don't understand the need for veterinary care and the level of their misunderstanding. One of the really striking findings from this study was how many clients don't understand the need for veterinary care, and the level of their misunderstanding was also alarming. Many clients said that if it wasn't for vaccinations, I wouldn't take my pet to a veterinary practice. Clients seemed to think that as pets got older, they needed less veterinary care instead of more. And clients also felt that if their pet was an indoor pet, it didn't need nearly as much veterinary care as one that went outside did. And of course, we all know if you have a pet that goes outside, certainly some risks are increased. I mean, it's more likely the pet will get into a fight with another animal or be hit by a car, but indoor pets get many illnesses as well. We all know they get cancer, they get diabetes, they get kidney disease, but unfortunately clients don't seem to be making that correlation. We also ask veterinarians about their attitudes toward wellness exams and toward communicating with clients, and about 70% of practices said that they view wellness examinations as the most important service that their practice performs. And that attitude correlated highly with practices that saw increased visits. So practices that are focusing on preventative care and on wellness exams and communicating that to their clients definitely saw some success in increasing the number of clients' visits. But a very large number of veterinarians also said that wellness exams are a commodity that pet owners don't value. So this kind of communication is a challenge, and it's something that we're going to have to continue to work hard at if we're going to help clients have a better understanding about the care that their pets need, and then use that understanding to visit a veterinary practice more frequently. Veterinarians are clearly recommending annual exams for adult, non-senior pets. About 80% of veterinarians said that they recommend annual exams for dogs. About 83% said they recommend annual exams for cats. The other roughly 20% in both for dogs and for cats either recommended twice-a-year exams or some other frequency. But the vast majority of what veterinarians are telling their clients is you need to see a veterinarian either with your dog or your cat once a year. Unfortunately, what we find is that clients aren't necessarily doing what we recommend. About 85% of dog owners, now remember that this is 85% of the people who visit a veterinarian, so there's a whole chunk of people out there who don't visit a veterinarian, but 85% of dog owners who do visit a veterinarian on some kind of a regular or semi-regular basis had seen a veterinarian within the last year. And when you look at cats, the number is much less. Only about 60% of cat owners had brought their cat to a veterinary practice within the last year. And again, remember, that's 60% of the people who at least see a veterinarian. That doesn't include the chunk of cat owners who never visit a veterinarian. So what we recommend as veterinarians is not necessarily what our clients do, although dog owners are certainly more compliant with our recommendations than cat owners are. In one of the earlier chapters, we looked at services a practice could offer in order to bring clients into the practice more frequently. But we also looked at non-service type attitudes that, if those changed, a pet owner would be more likely to visit a veterinary practice more often. And what was interesting is that the top 4 of these items were all about communication and education of the pet owner. Again, the top 4 items were the same for both dog owners and cat owners, although the order varied slightly and the percentages varied slightly. But pet owners strongly said that I would visit a veterinarian more often if I knew I could prevent problems and expensive treatment later. They also strongly agreed with the statement that I would visit a veterinarian more often if I was convinced it would help my pet live longer, and that if I really believed the pet needed exams more often. So those 3 items are all about understanding the need for veterinary care, and about education by the veterinary practice. The fourth in the top four was about price, and they said I would take my pet to the veterinarian more often if each visit was less expensive, and we'll talk about price in the next section. So what do we do in order to help pet owners understand more about the need for care and then consequently visit the veterinarian or a veterinary practice more frequently? There are things that can be done both on an individual practice level and on a profession-wide level. One of the most important things that we need to do is develop a mantra, and this would be similar to what we see in the dental field, the twice-a-year dental cleaning. There's not any of us out there who seriously believe we should not be visiting the dentist twice a year. The dentists have done a fabulous job of helping us understand how important twice-a-year dental cleaning is. We don't have a mantra like that in veterinary medicine. Some practices tell clients that they should bring their pets in twice a year. Some say once a year. Some have some other recommendation that they make. Some practices are very good at communicating the need for annual exams to their practices. Others are not. And because of this, many clients are confused. They either don't know what the recommendation is or they don't believe the recommendation because they're hearing different things from different sources. And when pet owners are confused, when any of us are confused and there's too many options and we don't know how to make a decision, we simply don't do anything. So until we can develop that mantra and speak as one voice as a profession and as one voice amongst the people in our own practices, we're going to have trouble getting clients to understand what the need for care is. One of the key things that needs to happen in a practice once you've actually developed this mantra, so you need to set the standards for the care that you think every pet should get in your practice, is it's also critical that doctors and staff tell the same story. It's not uncommon in a practice to see doctors that practice fairly different veterinary medicine. So if a pet owner brings a dog in with an ear infection, if it sees one doctor in the practice, they may have an exam and be sent home with some medications, and it costs, and I'm just making these numbers up, $100. If that pet owner were to bring the same dog in and see another doctor in the practice, they may get a much more extensive workup. They may get have the ears flushed and cleaned out. They may have cytology used to determine the medication. And the process used by that veterinarian is different from the first veterinarian, and maybe it cost $200. What is a problem about those kinds of differences in the way veterinarians practice is that it's confusing to clients and confusing to staff. If that client comes to a practice where they don't regularly see the same doctor, they may very well see different doctors for different problems, and one of the doctors develops a reputation for being the cheap doctor. But it's almost impossible in a client's mind to reconcile those kinds of medical differences, because either it looks like the first doctor didn't do enough work and so it wasn't appropriate from a medical standpoint, or it looks like the second doctor did too much work that wasn't medically indicated and now it's all just about money. Even if the client can't tell the difference between the levels of care that the doctors offer, the staff can. And if the staff can't understand and can't explain why one doctor does things one way and another doctor does things another way, we've just lost the ability to utilize staff as one more form of communication with pet owners, because they don't know how to explain it, they don't know why there are differences, and they don't know what to recommend. So instead of making a recommendation and being yet another person that the pet owner can talk with, they simply don't say anything. So it's critical that within a practice, doctors practice similar forms of medicine. It doesn't mean that they're always going to do exactly the same thing for every case, but there needs to be a similar approach to the common kinds of cases that are seen in a practice. It's also very clear from this study, particularly from the focus groups that we held with pet owners, that we need to educate clients about why exams and wellness care are so important. It's not enough to simply say, yes, you need annual wellness exams, but we need to help them understand why that's true. So it'll help your pet live longer. It'll help prevent expensive problems later. We'll get early diagnosis of some serious conditions if indeed your pet had that kind of a condition. Clients simply can't make the leap from what the recommendation is to why it's important. They simply don't have the medical background to do that. We also need to educate clients about what the exam includes. Many clients simply don't recognize that we are doing a full physical exam on their pets. They think you're just holding the pet on the exam table or you're petting it, but they don't really recognize that you're doing that tip-to-toe physical exam. It's also important to remember that we need this one message in a practice, which is coming back to the idea that doctors and staff need to tell the same story, but we need to communicate that message via multiple kinds of media. People learn differently, and so they need to hear things from a doctor, they need to hear things from staff, they need to see it on the website, the message needs to be reiterated in brochures. So all of the different ways that we can communicate with clients we need to engage in all those different kinds of ways, but we also need to make sure we're telling the same message each time we tell the story. There are also things that the profession needs to do in order to better educate pet owners. Again, we come back to the concept that as a profession we need to be speaking with one voice, and there is an initiative underway that's aimed at just that. It's called the Partnership for Preventative Pet Health Care, and this is an initiative between AVMA, AHA, AAVMC, and many companies in the animal health industry. It's a fairly new initiative. It was announced at the AVMA conference this year in 2011, but they have a significant long-term plan that includes putting together guidelines for basic care, basic wellness preventative care for both dogs and cats, a veterinary outreach program that would include tools and resources veterinarians can use to help increase visits, and then also consumer outreach, so messaging to the pet owner population to help them understand the need for veterinary care. You can register at the pethealthpartnership.org website, and as this information becomes available and their plans develop and the tools and resources are available, you'll get communication from them about that. Let me touch just briefly now on one of the first things that this initiative has accomplished, and that's the guidelines for dogs and guidelines for cats. As we've talked about, our profession needs a mantra. We need to all agree that this is the basic minimal care that every pet should get. And this partnership has already put together a one-page set of recommendations for dogs and a one-page set of recommendations for cats. They've been approved by AVMA, approved by AHA, and are now available. And this is a great resource for your practice to use as a starting point in setting those standards and having everybody, not only in your practice, but everybody in the profession, speak with one voice. One of the things that was very interesting about this study was what veterinarians thought they were doing when they were communicating with clients and how clients perceive that. So about 51% of practice owners said they completely agreed with the statement, "I talk my clients through the exam, explaining what I'm doing in detail." Another 37% of the practice owners in this study somewhat agreed with that statement. So almost 90% of the veterinarians who responded to this survey agreed with the statement, "I'm talking my clients through the exam and I'm explaining to them what I do." What's interesting is to see how pet owners perceive that. When we did the pet owner survey, we had a statement that was, "My veterinarian communicates with me in language I understand." And 57% of pet owners agreed with that statement. 43% of pet owners did not fully agree with that statement. The second statement that was about communication was, "My veterinarian clearly explains when I should bring my pet in." 44% of pet owners completely agreed with that statement, but 56% of pet owners did not completely agree with that statement. So what this is telling us here is that, number one, we have veterinarians who think they are fully, completely explaining things to clients in a way that they can understand, and yet, depending on which of these statements you look at, about half of pet owners say, "I don't get it." So we're asking clients to make decisions about care that is sophisticated, that they don't understand, because most clients truly don't understand medicine. We're asking them to make decisions about something that is scary, because this involves the health of a beloved companion. And we're asking them to make decisions about something that's expensive, and we can't even explain it to them in a way that they understand. Clearly, we as a profession have got to work on how we communicate information to our clients. If we're going to ask them to provide this care for their pet and to pay us a reasonable price for it, we simply have to make them understand why it's important, and the onus for that communication is on us. We talked a little bit in one of the earlier chapters about this driver analysis, which was part of the Bayer study. And one of the attributes that was most associated with increased visits was the concept that a pet owner sees the same veterinarian almost every time they visit the practice. And that was clearly linked with increased visits in veterinary practices. And yet what is interesting is that when you look at what is actually going on in veterinary practices, it's all over the board. So the statement in the study was, in my clinic, a client is assigned a veterinarian whom they see on nearly every visit. And only 29% of practices fully agreed with that statement. So less than a third of practices truly have clients see the same veterinarian almost every time. About 20% of practices somewhat agreed with that statement, and then greater than 50% were either neutral about that statement or disagreed with it. So we are not, as a whole, having clients see the same veterinarian every time or almost every time that they come to a practice. And we really need to think about the impact of this in trying to attract new clients. And whether this doesn't happen by accident in practices or whether that's a policy of the practice, we need to look at it and see if it makes sense. To me, if we want to be able to communicate better with clients, what we need to do is we need to build a relationship with those clients. And it's very difficult to build a trusting relationship if you don't see the same person every time. So every time the pet owner comes in, they've got to start a new relationship with a different veterinarian. They may see somebody they've seen before, but it's been a year ago or 2 years ago. But what they don't have is a long-term relationship where they have confidence and trust in the recommendations that that person is making. To me, the corollary in our own lives and in human medicine is, how do you feel about your pediatrician if you have kids? So when you take your kid to the doctor's office, do you want to just happen to see whichever pediatrician is randomly available? And I think almost every parent would say, no, I want to have a relationship with my pediatrician. I want somebody that I know and that I've seen regularly and that I can trust. And why should it be any different in veterinary medicine? So this is an area that I think we strongly need to look at in our practices. Again, in the driver analysis, one of the attributes most associated with increased visits was that concept of wellness exams. So the practices who believe wellness exams are one of the practice's most valuable services definitely saw an increase in clients. So it's up to us to focus on that as an important as an important service that we offer in our practice, and then make sure that we're communicating that to clients as well. This information comes from the Veterinary Economics 2009 State of the Industry report. And if you look here, you'll see across the bottom of this slide a bunch of services that practices regularly offer. And then what this survey did was it asked practices, which of these services or how frequently do you recommend these services to clients? And then how frequently do you, the veterinarians in your practice, actually do this for your own pet? And you, team members in a practice, how often do you provide this level of care for your own pet? So what we saw here, and this is a dog slide, but the cat information was similar, is that in general, we recommend care to our clients much more frequently than we actually provide it to our own pets. So the blue bar is how frequently we recommend this to clients, or how frequently we think they should do this. And then the red bar is how frequently veterinarians actually do this for their own pets, and the green bar is how frequently team members actually do this for their own pets. You can see here that we recommend this to our clients much more than we actually do it for our own pets. So this opens up a big question, and is, do we really believe in our recommendations? I mean, if we're not doing it for our own pets, why is that? You know, certainly if you work in a veterinary practice, it is much easier to provide this care than it is if you're a random pet owner. I mean, you work in the practice, you can bring your dog or your cat with you to work, you can put it in a cage, somebody will help you administer the care, you probably get a discount on how much it costs. Think about what it's like for a regular client. They have to take time off work, they have to bring the pet in, it's going to cost them some real money. So if it's easy and less expensive for us and we don't do it, why is that? If we don't believe in the recommendations, then why are we making them? And if we do believe in them and we're not providing them for our own pets because it's expensive or because it's not convenient, then think about how difficult it is for pet owners who are going to pay more and it's more difficult for them, and what can we do to make it easier for them. There is a similar part of this veterinary economics survey also looked at care recommended for cats and then care provided for cats. Very similar findings, except the gap between what we recommend to clients for cat care and what we actually do on our own cats was much greater than you saw with the dogs. So very clearly, this need for communicating care to pet owners is huge. Many pet owners don't understand the need for care, but we also aren't communicating it nearly as well as we need to. So in the next chapter, we're going to talk about pricing. And of course, pricing ties in with the need for care and the value of the client experience that the pet owner thinks that they're getting. So we'll talk about those issues as well.